Welcome to Medicine Handy Point. Today we will discuss the clinical signs and if a patient present with hepatosplenomegaly and we find it on clinical examination, so how will we will approach the hepatosplenomegaly from clinical science point of view. So these series of lecture will be regarding the clinical science, means the examination findings. So when we find a hepatosplenomegaly on examination, then what other sign we should look for? So let's discuss that. First, we will discuss the causes for hepatosplenomegaly. So it's very important. What are the causes? So we will discuss that. First is infections. The common infection which causes hepatosplenomegaly are malaria, enteric fever, kala azar, which is visceral leishmaniasis, infection mononucleosis, and cytomegalovirus. Then are myeloproliferative disorders. These are CML, chronic myeloid leukemia, polycythemia rubra vera, essential thrombocytosis, and myelofibrosis. Then are lymphoproliferative disorders. These include chronic lymphocytic leukemia, lymphoma, multiple myeloma, Waldenstrom, macroglobulinemia. Then is cirrhosis with portal hypertension. Then other causes includes connective tissue disorders like SLE, Sjogren syndrome, and rheumatoid arthritis causes Felty syndrome, sarcoidosis, amyloidosis, thyrotoxicosis, acromegaly, everything get enlarged, storage disease, which include glycogen storage disease and lysosomal storage disease, and hemolytic anemia. Then, once we have found out there is hepatosplenomegaly on the examination, then we will search for other signs which could guide us towards the cause of splenomegaly. So, we will start with general physical examination, which include looking at the skin pigmentation. Skin pigmentation can occur in kala azar, hemochromatosis, and CLD patients. Then we will look at the hands for anemia, jaundice, palmarythema, hepatic flare, spider angioma, gynecomastia, loss of axillary hair, and abdominal distension, which will suggest chronic liver disease. Then we will look at the face for frontal and parietal bossing or mongoloid faces, which may suggest hereditary hemolytic anemia. Then we will look for the lymph nodes in the neck, which will suggest lymphoma, CLL, and infections like infection mononucleosis and CMV. Then we will check for the sternal tenderness, which may suggest leukemia and lymphoma. This is how we will approach a patient presenting with hepatosplenomegaly on examination, and how we will approach the patient from examination point of view, clinical science point of view, when we find hepatosplenomegaly on examination. I hope you like the video. Please subscribe to the channel.